It is Wellness Wednesday, and today we are talking about World Pancreatic Cancer Day happening tomorrow. Dr. Hazem Tabbaa is a gastroenterologist at Memorial Healthcare. He joins us in the sponsored segment to talk more about different signs to look out for regarding pancreatic cancer. Good morning.
Good morning. Thanks for having me.
Yes, thank you so much for coming in. First off, when is World Pancreatic Cancer Day?
November 16th, and that's, I guess, recognized worldwide.
Yes, so why is that day so important?
Pancreatic cancer is a growing cause of cancer around the world. It accounts for about 3% of pancreatic cancer in the U.S. And growing from there. So it's something we're trying and becoming better at detecting, and that's leading to better outcomes with treatment of pancreatic cancer.
Well, that is certainly encouraging to hear. What are some of those risk factors to be on the lookout for? Because pancreatic cancer, it's scary when people first hear about it. It can be.
Absolutely. So things to look out for are definitely knowing your family history, being aware of kind of family members that may have had pancreatic disease or pancreatic cancer, obviously. Other things to look out for are obesity, history of heavy alcohol use, tobacco smoking. Those are kind of the leading risk factors for pancreatic cancer.
What about as far as signs? What should people be on the lookout for? Are there obvious signs there with pancreatic cancer?
Yeah, some of the major signs, early signs, are things like unexplained weight loss, changes in appetite, weight loss, like I said. Other things, kind of more obvious signs, are changes in skin color, so yellowing of the skin, yellowing of the eyes, abdominal pain, changes in your urine color, so dark colored urine is also something we look for.
And why is that? Does that have to do with your body absorbing or not absorbing food and things like that?
Correct. So a lot of it has to do with obstruction that can happen in your biliary tree, which is the area of the liver. So the area of the pancreas, the liver, the bile ducts is a very intimate area. So when there's disease in one area, it can affect the other. And when there's an obstruction there, your body isn't draining digestive enzymes the way it normally does, and that can change, and show up in different symptoms with yellowing of the skin and eyes, etc.
Now, with all that said, what should someone do then if they feel they may be at risk?
So one of the main things, obviously, is to let your doctor know as soon as you see any of those types of signs creep up. And then if they feel that you need to be seen by a specialist like a gastroenterologist, that would be the next step. And there are several procedures that we can perform and imaging studies that we can perform to help diagnose, detect, and potentially treat if there is any type of pancreatic disease there.
Yeah, and then just quickly, you mentioned there's been advancements in treatment. That's encouraging. Any examples of that?
Absolutely. So we do procedures, especially at Memorial Healthcare Gastroenterology. We do procedures like endoscopic ultrasound and ERCP. Those are kind of the cutting edge procedures that allow us to detect very, very subtle pancreatic disease and pancreatic cancers and potentially start the treatment algorithm early on, and that's leading to better outcomes. So we're making headway in treating this.
That's always encouraging to hear, and you'll be in good hands there at Memorial. Thank you so much for coming in.
Absolutely.
And helping us raise awareness ahead of World Pancreatic Cancer Awareness Day. For more information, you can go there to the website memorialhealthcare.org, or you can call that number you see there on your screen, 989-720-CARE. Thank you for the information.
Thanks for having me.
Yes.